An inflamed intestine can no longer absorb nutrients properly. I'm sure you have already heard terms like irritable bowel syndrome, leaky gut, or intestinal inflammation, and also have many questions about it. Let me try to clear things up for you. What is irritable bowel syndrome, or what is leaky gut syndrome? It is the same thing. Irritable bowel is the German translation for leaky gut, but we have to know what leaky gut stands for, either with holes or permeable gut. Of course, the colon has no holes, otherwise the intestinal contents would run out into the abdominal cavity. But the mucosa of the small bowel is permeable to toxins that should not enter the body. Whether we use the term irritable bowel or leaky gut, it is the same. Irritable bowel syndrome is caused by external toxic substances. This may be due to food intolerance. It can be e-substances or environmental toxins and so on. We just don't tolerate anything that goes into the stomach. This damages the intestinal mucosa and can cause this irritation. What is inflammatory bowel disease? We are talking about Crohn's disease or ulcerative colitis. These are serious intestinal inflammations. Crohn's disease can be located throughout the intestinal tract. Ulcerative colitis can only be found in the colon. Both of these diseases are autoimmune. Recent findings are starting to cast doubt on this, but currently they are considered autoimmune diseases and inflammations. How do I treat these bowel diseases? The treatment for both leaky gut, Crohn's disease or ulcerative colitis is exactly the same. I treat in 2 phases. In the first phase, I use Toxaprevent, this clinoptilolite, which is able to bind histamine and heavy metals. In addition, an anti-inflammatory product like turmeric or chokeberry, and I always add vitamin D and omega-3. In the second phase, we need to rebuild the health of the gut with a good probiotic and a special product called NeoVital. You will find a video in the description below where I talk about this process. Although the treatment is the same for all these diseases, you need to know with inflammatory diseases like Crohn's or colitis, treatment takes much longer than for a leaky gut. A leaky gut treatment can already take 6 to 8 weeks, sometimes even months. For Crohn's and colitis, the treatment takes much longer. A year and a half, yes, maybe even more. Here, below in the comment section, you will find a separate website with a link to my therapy plan for these diseases. You will find valuable advice on how you can get back to better gut health.